Thank you, Selma. Hi, everyone. My name is Jebet. I work with the Global Network of Young People Living with HIV, and I will be presenting the abstract on the midterm review of the Youth Care Project, a brief of the Youth Care Project. Youth Care is a consortium that aims to empower adolescents and young people between ages 10 to 24 in Kenya, Tanzania, and Zambia by expanding their access to self-care services, mostly digital, and access to mental health as well. The project advocates for adolescents and youth engagement in self-care to fulfill their SRHR needs. The WHO definition of self-care is the ability of an individual, community, or family to take care of their own health, basically granting the power of health to an individual, meaningful engagement of self. The midterm review evaluated progress, identified best practices, and informed strategic decisions for the project's second half, that is 2024 to 2025. The project Youth Care is implemented alongside two pathways from the theory of change. Pathway one is lobby and advocacy for an enabling environment, basically looking at policies and decision makers who influence policies and how this affects self-care. And two, capacity strengthening and advocacy for quality services. That is looking at the individual as well as the ecosystem that influences the individual, including healthcare providers and project implementers as well. The midterm review was done in 5 stages. Step 1 was a review of project documents, including indicator reports and other important project documents, followed up by a stakeholder consultation, which was mostly targeted at the project beneficiaries, that is young people, healthcare providers, and the policymakers that we engaged as well. Step 3 involved drafting of the report, where we put our initial findings together into a draft report before it went to the validation. And the validation was done by the project implementers and the young people as well before the final report. I'll look into the results. I will not look at all the key performance indicators that we looked at, but in pathway 1, the highest 2 achievement rates were the number of consortium partners with increased knowledge of evidence and messaging required for effective advocacy, which was at 180%, so this was above target. As I mentioned, the consortium is of 6 organizations, if I'm not wrong, but we went beyond that and we engaged 30 organizations and also developed policy briefs at 54%, and the exact number is 13 policy briefs between the 3 countries. Within pathway 2, which looks at capacity strengthening, the 2 highest scored key performance indicators were the number of public health service providers trained to deliver quality psychosocial care and support, which was at 114%, and this was 234 healthcare providers across the 3 countries, as well as the number of health facility quality improvement plans developed, which was at 127%, and this is 42 healthcare centers. However, a gap that was identified was extending outreach to more adolescent boys and young men, which is essential for the program to achieve its initial objectives. Into findings and learnings. 1, implementation of youth leadership, where young people were heavily involved in outreach programs and in all levels of programming for the project. 2, implementation of the gender transformative approach, where youth advocates mentioned awareness of gender transformative approaches and also implemented these approaches in programming. Number 3 is implementation of the rights-based approach, where again youth advocates mentioned awareness of the rights-based approach and were sensitive to diverse groups and respect for human rights. And number 4, partnership and collaboration, supporting achieving project goals, where generally roles and responsibilities were well defined and understood by all key players in the project. In conclusion, the consortium partners' expertise positions them well for pursuing collaborative partnerships and funding opportunities beyond the project, as well as establishing clear targets for key performance indicators and implementing annual goals in addition to end goals would enhance progress tracking. My reference point was the Youth Care Consortium, Midterm Review of the Youth Care Project 2024. And a special appreciation to all the consortium partners of the Youth Care Project. AIDS funds the fund of the project as well. Thank you.